Welcome back right there. Still this morning on IT. We are talking about universal healthcare coverage, and the focus of this year 2024 of universal healthcare coverage has to do with role of financial protection in accelerating progress toward universal healthcare coverage right there. And talking about out of pocket, people don't get to pay out of pocket, that becomes so difficult for them to continue with their life. And the healthcare coverage is meant to have financial protection to ensure that people don't fall into poverty because of having to pay out of pocket for health costs right there. This is very important, especially in the face of some of the challenges being faced by people out there in a bid to meet up with the cost of health coverage and so many other things right there. So let's join with Victor Ezewa right there, who is joining us via Zoom to take a look at this and the implication of this healthcare G2024 program. A wonderful morning to you, Victor.
Good morning. It's my pleasure to be part of this discussion this morning.
Okay.
Good morning.
Okay, thank you so much right there. Let's hit the ground running. This year team is focusing on the role of financial protection in accelerating progress towards universal healthcare coverage. That is, we are talking about financial protection to ensure that people don't fall into poverty in a bid to cover their health costs. Put into consideration the current situation in Nigeria, how do you juxtapose this? The focus of this year and the current situation on ground in Nigeria.
So it's quite unfortunate that Nigeria is yet to achieve the minimum benchmark of universal health coverage for all its citizens. Currently, we are doing less than 10% coverage for universal health, for all Nigerians. And we are supposed to be at least having a percentage ratio of about 70% coverage. Universal health is meant to be for all, including the aged, the infants, the young ones. But currently, the universal health coverage of Nigeria is covering just less than 10% of its population, which is very, very low. And so I think the government has a lot of role to play to ensure that it painstakingly adopts every approach that is within its power to ensure that every citizen of Nigeria is covered. That is why we do this, we mark these events on a yearly basis. And unfortunately, nothing much has changed. The resources allocated to health is very poor. There is an Abuja declaration of 15% budgetary allocation to health. The reason why that allocation was pegged at 15% is to ensure that much resources is dedicated and allocated to health. But if you check the trend of our budgetary allocation for the past 5 years, we've not done more than 5%. So compare 5% to 15%, which some other African countries have already started adopting. You discover that the commitment of government seem not to be, substantial to ensure that the citizens actualize the universal health coverage in Nigeria. We are also looking at the issue. Universal health coverage can also be achieved through the health insurance scheme. When you have a health insurance scheme that people can easily key into, they don't need to pay out of their pockets when they go to the health facilities. That is a way to ensure that everybody is covered. But Nigeria, we are also currently having 70% out of pocket expenditure. That means for every citizen that go to the hospital to access care, they have to pay out of their pocket about 70%. And if you also do a side-by-side analysis of the accessibility of income of Nigerians, you discover that not everyone can afford that. People are looking for what to, eat first and foremost before they could now choose to go to the hospital to access care. And when you go to the hospital, the cost of accessing medical care is very, very expensive at the moment. We are all aware that most of the health care companies, the pharmaceutical companies, have left Nigeria, leaving those products, the consumables, medical consumables, to be on a very unaffordable, unreachable rates for Nigerians. And the only way governments can come in is to ensure that they subsidize most of these medical consumables through health insurance, so that if every citizens pay a fraction of their income on a monthly basis or on an annual basis, as the case may be, they can easily go to the hospital at any time and access care for any medical condition. That would also be a means of revenue generation for the government, because if you imagine a scenario where we have about 220 million population citizens in Nigeria, imagine a scenario where 80% of that population is paying for health insurance. That would be a very large pool of funds that would also be vital to the improvement of the health sector in terms of infrastructure, in terms of medical consumables, in terms of human resources for health, and every other aspect of the health sector that is germane, to the functionality of the citizens. And so government needs to do a painstaking effort. What they've done so far is to sign the National Health Act, National Health Insurance Authority Act, that provides for a mandatory health insurance for all Nigerians. But they've not gone beyond that to ensure that these laws are enforced, to ensure that people follow the dictates, the provisions of the law, to register. Every organization, both in the formal and informal sector, have provisions to ensure that their employees register and key into the health insurance scheme. Even the informal sector, the artisans, people in organized groups, individuals and families are also expected to register in this health insurance scheme based on the law. So the law has been passed, the guidelines have been established, but at the enforcement stage, we have seen nothing coming from government, and this is what we need to reflect on as we mark the universal health coverage day.
Okay, now let me take you on the paying lip service to the law. You talked about the law that have been passed, but people have not been able to fully implement it. Let me give you an instance of when people want to leave Nigeria for another country. Part of the basic requirement is the health insurance. You must pay that before you can go to that country. But in Nigeria, how come we've never been able to hold our government or politicians to ransom when it comes to campaign, or we don't think the health sector is important? What do you think the reasons why people don't query some of these political leaders or some of these aspiring politicians about their programs for health? What plans do they have for the people when it comes to health? How come we don't do that? Do you have an idea of why people have not really been able to query their aspiring politicians, their leaders, on the importance of putting health structure in place when they are running for offices?
So this is one aspect where Nigerians need to brace up. We are obligated by the Constitution to hold our government accountable. And if we see health as a vital commodity that should be brought to the front burner in terms of governance, Nigerians should brace up and begin to interrogate, what is government doing? Why has government not gone beyond the level it is going to ensure that everyone is enjoying accessible and affordable health care? So Nigerians should take interest. We are sometimes disconnected from the real issues, and we are given to frivolous issues around social media and so many other things that spice up the entertainment of the individual. But we should be thinking of holding government accountable, and this is not just a challenge in the health sector but in every areas of governance. Nigerians have been fully disconnected. Most of the citizens of this country have lost loved ones. They've lost brothers, they've lost sisters, they've lost fathers, they've lost mothers because of government's negligence to the health sector, because of the lackluster treatments of our medical practitioners in various government hospitals. So Nigerians should see this as a very serious and it's very sensitive issue, and begin to engage the right people, engage through the National Assembly members representing them in their constituencies, engage the Ministry of Health, engage the budget office, engage even those that have access to the president, should engage the president himself. Let them see this as a very germane issue that should be given concerted efforts, and actions, the right actions should be taken to ensure that we walk into the hospitals are fully functional, the drugs are available, the right medical practitioners that should be attending to patients are there and fully employed. These are the issues we need to be talking about. It is so unfortunate that when you walk into any general hospital, it is an eyesore. The number of persons waiting to be attended to. If you have very important things to attend, you might tend to miss your appointment with the doctor because of the crowd. You practically spend the whole of your day in the general hospital. It's not supposed to be so. The patient to doctor in Nigeria is very low, and it needs to increase. We need to build more facilities. We need to refurbish healthcare centers so that those who do not have business going to the general hospitals can easily walk into the nearest primary healthcare centers in their community and access medical attention in the right quality and the right reasonable at a reasonable rate using the universal health coverage template. So this is what citizens should be looking at. They should be tasking their elected representatives and also engaging the government to ensure that the health sector is revamped and is working for all Nigerians. We don't have any business traveling abroad. We shouldn't be wasting our capital flights. We shouldn't be pushing capital flights, exchanging the naira to the dollars because we want to get well, we want to be alive, and we go to other countries. No, we have the potentials. Nigerian medical doctors have been rated as one of the best outside this country. They are right here with us. With the right medical training, we have been able to produce doctors that could, that could stand their peers all over the world. So why don't we invest more in this sector, build the right facilities, employ more doctors, so that it will be something that people do not need to struggle to access. So Nigerians should take full interest in this form of engagement. The ball is on us. The onus is on us as citizens of the country to engage robustly on these issues.
Okay, now let's take a look at the quality of the healthcare system and the quality being that. You talked about the National Health Insurance Scheme, but we've had instances where some certain hospitals do reject people on NHIS, saying the amount being paid is not even enough. Let's take, for instance, treatment of malaria. The amount being packaged in the healthcare scheme cannot even treat malaria. Most instances, you see people settling for drugs that are not even of high quality because of the amount being provided under the healthcare scheme. How do we tackle this? Because we've seen some hospitals saying they don't want to work with NHIS because the amount of money being allocated is not enough to take care of even ordinary malaria. How do we get around this?
So this is a conversation the federal government or the state government needs to have with the various healthcare providers. They need to agree on a template, on a cost tariff for every medical consumables. The burden should not be placed on the receiver, on the beneficiaries, on the citizens that walk into the hospital, only for you to be told that your NHIS package does not cover the kind of treatment you want to receive. No, it is not the business of the beneficiaries, but this discussion should be reached between the federal government, the state government, and the various healthcare providers, and of course with the HMOs, the Health Maintenance Organization. They should agree on a cost tariff where the government will now determine how much should be paid per any medical item that is consumed by the consumers. It is not at the point of receiving care that the hospitals will now be turning back patients. It should be a criminal offense for any hospital to turn back patients on the basis of the cost, because the first thing that should be done before you agree to receive any patient under health insurance is to agree on the cost tariff with with either the employer or government, the government in this case as the employer for civil servants, and of course for the private sector, the owner of the organizations agree with the HMO and the hospitals on what should be cost tariff, so that if the beneficiaries ends up in the hospital, they don't have any business talking about the cost. Of course, the citizens would also be aware of what plans they are entitled to and what it can cover. So if you have this information, when you get to the hospital, you are not supposed to be debating on the amounts listed for any of the services you want. There is also option to upgrade. If your tariff, if your plan is low, then there can be an arrangement to also upgrade for the person to receive the right care that he or she deserves when they go to the hospital. The idea of health insurance is a prepaid medical expenses, whereby you need care, you walk into the health facility, you assess it without spending a dime. If there's any need for any form of adjustment in terms of tariff rates, that discussion should happen between the health management organization and the health provider and the employer. In this case, we are talking about government now. Government is the employer. The government should be able to negotiate with the health facilities on the right tariff for every aspect of medical consumable that is required. Now, to say the least, malaria is one of the common sickness that Nigerians go through.
Okay, well, just come little technical issue there, but very soon we have Victor Ezewere back right there. He was talking about the NHIS, the HMOs, and also looking at treatment, the money that is supposed to be meant to take care of these things. And hopefully we can get Victor Ezewere back right there with us to talk more on that and the implication of this and a whole lot of issues there, role of the NGO in ensuring that government meet up with their own part of the agreement, because it is very critical for us to be able to get the best health care for the populace. But how are we able to do it? Everybody do have a role to play. We should be able to hold accountable leaders in different sectors of life, right from the councillorship area down to the local government level, to state government level, to state level. Well, we have Victor back. You were talking about the issue concerning the aspect of malaria.
Yes, so I'm saying malaria is one of the common ailments Nigerians visit the hospital for. So the issue of the cost tariff on malaria or any other related medical conditions that is being assessed by Nigerians on a regular basis should not be an issue to be debated between the health facilities and the beneficiaries, the citizens. So these issues, they have a way of being sorted by the HMOs and the healthcare facilities. So it is unfortunate to know that Nigerians go to the hospital and they are turned back because their health plan, their health insurance package does not cover for common drugs like malaria treatment. It is not something that any government should take lightly. This issue should be investigated and it should be resolved with the healthcare facilities. There are very common sicknesses, very common medical conditions that such tariffs on a year-by-year basis, on a routine basis, the government should agree with the healthcare facilities on the cost tariff for each of these particular medical items.
Okay. You raised the issue about review, because when you look at the level of inflation, definitely the amount being allocated for 2 years ago may not necessarily work with this current state of the. But lastly, before I let you go, what is the role of NGO WHO in ensuring that government continue to fulfill their part of the agreement by not just paying lip service to some of these things, just pass into law, but does not ensure that it's being implemented. What is the role of NGOs and WHO and other major international body in ensuring government is held accountable?
So NGOs have been known over the years to stand as an intermediary between the citizens and the government. They play several roles like educating, sensitizing the public, advocating to the government stakeholders to do the right things, just like what we are doing now in the studio, talking about these issues. These are the roles of NGOs. We talk to the government, we appeal to their conscience. Sometimes we even go, forcefully to get them to do the right thing. Sometimes we need to also apply our skills, knowledge to do a review, research work, and present vital recommendations to the authorities for them to adopt, like providing technical assistance to the government. And for the citizens, we do a lot of sensitization. We talk to them about the need for them to engage, for them to ask the right questions, for them to also know what steps to follow to be able to enjoy some of the facilities that the government has provided. So the work of an NGO goes on a rolling basis, is to assist the government sometimes in doing their job, and also to make the citizens to also engage perfectly and properly with the government. It's a two-way thing. So we stand at the middle to bring both the citizens and the government together to assess the right services that is required. And of course, we've also had international development partners supporting NGOs to carry out this assignment. And so it is about the supply side, listening to the voice of the NGOs. We can only appeal to their conscience. We can only do all that is necessary for us to do. So it's now left for the government to now implement some of our recommendations and some of the requests we are making to them. We cannot do it on our own, but we need to bring it to their table for them to enforce. That is where our work stops. But we will keep on as an obligation, as an NGO, to keep on talking to the government to do the right thing, and also engaging the citizens to demand for what is rightfully theirs.
Okay. I must say big thank you to you, Mr. Victor Ezewa, for joining us this morning and shedding light on this particular issue, World Health Coverage Day. Thank you so much for linking on with us.
Thank you very much. It's my pleasure.